Okay. So just welcome to West Hudson Psychiatric Society, our members and our guests. Our district branch has been focusing for the last couple of years on making psychiatry more present in the community by engaging in different projects, and certainly we've been able to reach that goal more fully since the start of COVID-19. West Hudson has been trying to find ways to serve our community, from volunteering short sessions to individuals that were impacted by the pandemic, to running a group for psychiatrists and manning a helpline for physicians who are affected by COVID, among many other projects. It was in this endeavor, actually, that we came across Dr. James Gordon, the founder for the Center of Mind-Body Medicine, who has this as one of his longtime goals: teaching thousands to heal millions. Dr. Lois Kroplik, the chair of the disaster committee, invited me to hear one of his lectures, and I went onto his website after that, and I've been inspired to watch more than 11 of his talks and to read his book, plug, The Transformation, which I really very highly recommend. I use what I've learned from Dr. Gordon almost daily in my practice. And in fact, true to his mission, I just gave a talk today to the AARP and helped them to experience his soft belly concentrated meditation that I'm sure he's going to open with today for us, I suspect. During disasters, there are predictable emotional highs and lows that we endure. SAMHSA has posted on its website a graph depicting the predictable phases of a disaster, ranging like a 6-act play, from pre-disaster to impact, the heroic phase, the honeymoon phase, which is the highest emotional well-being of a disaster. And then that is followed rapidly by an extended 3-pronged period of disillusionment, which I believe that we are currently in. And this is followed then by reconstruction and new beginning. And in fact, that may be even a little bit better well-being than we began with. That shows some of the resilience that can come. Dr. Gordon provides, I believe, the limitus or threshold through which we can pass in order to reconstruct. And it's for these reasons that Dr. Kroplik and I and the Executive Council feel that he would be healing for both our communities and the communities that we all serve. So I'd like to introduce Dr. Kroplik, who will then properly introduce Dr. James Gordon. Dr. Kroplik?
Oh, thank you. I'm honored tonight to introduce Dr. James Gordon. Dr. Gordon is the founder and executive director of the Center for Mind-Body Medicine in Washington, D.C. He's world-recognized authority on post-traumatic stress and mind-body medicine pioneer. He's a longtime researcher at the National Institute of Mental Health, as well as a clinical professor at Georgetown Medical School, and he was chairman of the White House Commission on Complementary and Alternative Medicine Policy. Dr. Gordon has created and implemented one of the world's largest and most effective programs for healing populations worldwide, psychological trauma, and dealing with chronic stress. Since 1991, he and his 140 international faculty at the Center for Mind-Body Medicine has brought an evidence-based program of self-care and group support to communities in the United States and overseas that have been devastated by war, climate-related disaster, opioid epidemic, school shootings, and historic trauma. As Laura said, Dr. Gordon is the author of a recently published book, which I highly recommend, The Transformation: Discovering Wholeness and Healing After Trauma. On a personal note, on April 2020, I became a volunteer at the Physician Support Line, which is a national free support line made up of over 600 psychiatrists who joined together to provide peer support for our physician colleagues as we all navigated through this COVID-19 epidemic. As part of this volunteer program, we attend Saturday morning lectures, which are organized by the Physician Support Line. So one Saturday morning, there was the speaker, Dr. Gordon, who gave an outstanding presentation on trauma. And he had the audience participate in very inspirational meditations, such as soft belly and shaking and dancing, which I have used in my own practice. Dr. Antar and myself have attended that presentation and became instant fans of Dr. Gordon. And each Friday since that time, we participate in his weekly webinars. So when the executive council of the West Hudson Psychiatric Center was looking for a speaker on the pandemic, Dr. Gordon was the first person that came to both of our minds. I'm so excited to have Dr. Gordon present to us tonight on the topic, the transformation, caring for yourself and your patients during the trauma of COVID-19. I'd like to personally thank Dr. Gordon for giving this presentation and inspiring us to help ourselves and patients in the area of trauma and to recognize how we can change and turn the pain of trauma into a purpose and a mission. Please welcome Dr. Gordon.
Thank you. Yeah, that's nice. I think this is virtual applause. It's really nice. Thank you. It's really nice. Laura, Lois, and Liz. I like saying that too. And it's I really appreciate the welcome and the invitation, and it's great to be with all of you. And what I want to do is to share a little bit of my background, because I think it may be a little bit more of my background that may be useful for all of you. And then to tell you a little bit about not only how I got into doing what I'm doing with population-wide psychological trauma, but as Laura and Lois are suggesting, to share a couple of one or two techniques with you, and perhaps most important, to have a discussion with you about the issues that you're facing and how I and my faculty and the staff at the Center for Mind-Body Medicine have been meeting and working with and wrestling with, and hopefully sometimes creatively and often creatively resolving the issues that are coming to us. I've heard a little bit about some of the challenges that you're facing, and they're challenges that everyone in medicine and certainly everyone in psychiatry is facing right now. So let me get started. And I appreciate the mention of both of you mentioning, Laura and Lois, both mentioning the transformation. All of the techniques that we use are in the book. And I discuss how I use them with individual patients, with individual people, as well as how I work with them in a group and a community setting. And there's all the research in there, and there are the stories, and there are the scripts for about 15 different self-care techniques. And the book is designed so that you can read it, you can integrate the techniques, you can start doing them. And as you start doing them, and I'll come back to this point again and again, as you start doing them and they become useful and a part of your life, at that point, you can begin to teach them to other people. The model on which I'm working in some ways seems perhaps different from traditional psychiatry or psychoanalysis. For me, I was trained, I did my residency at Albert Einstein in the Bronx. I was trained, most of the people who trained me were psychoanalysts. I was in psychoanalysis, and I see that what I'm doing is a continuation of that tradition, that late 19th century tradition of dynamic psychiatry and psychoanalysis. And it's a kind of perhaps a democratization of that tradition. The work that I do and the work of the Center for Mind-Body Medicine, which I founded in 1991, is premised on our mission is to bring self-awareness, self-care, and group support into the center of all healthcare, the training of all health professionals, and the education of our children. And if you think about self-awareness and self-care, that is or should be, that is very much the heritage of dynamic psychiatry. It is also the heritage of the world's indigenous healing systems. And I'm somebody who's been both trained as a conventional physician, but has spent many years learning from many of those other traditions from Asia, European, old European traditions, Latin America, as well as Africa, and Native Americans as well. So I've learned, and what I'm putting together and the way I work, I see as a kind of synthesis of what is best in a variety of different traditions, together with modern Western medicine, and put together in ways that are individualized for each person. Now, I've already covered a lot of ground in what I've said, and I'm going to keep coming back to those pieces. My belief, my understanding, and my experience is that all of us have a great and largely untapped capacity to understand and help ourselves. And that understanding is there in psychoanalysis. That understanding, it's not something that's unique to me. And the job of the analyst, as I understood it and as I experienced it, was to help the analysand make discoveries for themselves. It's not about telling people what to do. And so it's a bit different from the medical model, which I was also trained in, and of course, which everyone here was trained in. The focus is not on doing things to or for other people, but on giving them the tools so that they can understand themselves and they can use these tools of self-care to help themselves, as well as to distinguish what makes most sense for them to do in terms of both self-care and decision-making in their lives. And added to this is the understanding of the great power of people coming together in processes of healing. And again, this is something that was certainly part of my psychiatric education in the 1960s, and this understanding of the power of groups. And this is also an understanding, and I'll come back more to this later, that is there in every indigenous system of healing in the world that I know of. And I've spent time with a number of them, but what there is in indigenous systems, and I'm just taking a little detour here and then I'll come back, is if you had a minor problem, whether it was a sprained ankle or a difficulty in a love relationship or a quarrel with somebody, and it was a small problem, you went to your granny, your grandmother, or somebody else's granny. And some of you may have experienced this in some of you who are closer to traditional cultures. And she had the basic first aid pharmacopoeia, psychologically, as well as physically, as well as spiritually and socially. If you had a major problem, life-threatening illness, major depression, suicidal feelings, psychosis, you went to the official healer in that society, whatever that healer's name was. Could be a wise woman, could be a witch doctor. One of my friends and colleagues in Mozambique calls himself a Dr. Witch. Could be a curandero, could be a sangoma, which is a traditional Southern African healer. And that person who knew the great pharmacopoeia of his culture and who was versed in the rituals would bring a group together for the healing process, because it was understood that in order to restore the sufferer to some kind of balance, one had to restore the balance between that individual and the social, natural, and spiritual world, and that a group was the medium in which that could happen. This is deep in our human history. We know about it for tens of thousands of years, probably much older than that. So what I want to emphasize to you, and what I'm going to sort of move into in more depth now, is that all of us, for most of the problems that most of us have, for most of the problems that we as psychiatrists face most of the time, not universal, of course, but people have the answers within them to what they need to do. And our job is to be, as our Greek ancestor Socrates said, a midwife to, he said, men's minds, but a midwife to everyone's mind. Our work is more like a midwife than an OBGYN, that we're there to bring out what's possible. And that the work that we do with people can be significantly amplified and deepened if we work with groups. Now, I'm not saying that working with a group is exclusive. Many instances, I value individual therapy. I was in analysis, I was in therapy, I do psychotherapy with individuals. The group provides something that is different and enhances work with individuals. And in my experience, particularly in the last 30 years, my experience is that group teaching people to take care of themselves in small groups, which are supportive groups, should be fundamental and foundational for everyone, regardless of the situation, regardless of the diagnosis, and that there are certainly numbers of people who also benefit significantly from individual therapy. So when I was doing a much larger practice than I am now, because mostly I'm teaching now, every one of my patients just about was also in a group. And I wasn't running those groups for the most part, but in one of the groups, the kind of group that I'm going to describe to you later. Okay, so I'm trying to set the stage for what we're going to do. And I think I'm sort of struggling. Are there any questions that anyone has to this point? Because I want to respond if there are things that are puzzling in what I say. I'll show you how this works in the course of this next hour or so together. And I'm going to very soon move into that soft belly breathing. But I wanted to check and see if there are any questions. Yeah, it's Laura.
So I have a question. So I actually went to graduate school for some time in anthropology. And I'm in a family of Kurds, right? So I get a lot of what you're talking about going into the more intuitive side. What do you think in suburban culture, which is where we are, right? What do you think the equivalent is of the grandma, of the shaman, of the, I too have never seen a society without it. What would you name, or what might be our version of that?
You are. You're the one who people are going to come to. You are the shaman. You are the one, psychiatrists in particular, physicians to some degree, mental health professionals to some degree, but especially psychiatrists. That's our mantle. Have you read Jerry Frank's Persuasion and Healing?
No, I haven't.
And anybody here read that, Jerome Frank? Oh, it's worth, you in particular should read it, because Jerome Frank was professor of psychiatry at Johns Hopkins and an enormously well-respected, lovely man. We were very good friends. He was one of my champions when I was at the National Institute of Mental Health, and I used to get in fights with the directors of NIMH and Alcohol, Drug Abuse, and Mental Health Administration. Jerry Frank would be there for me. Jerry Frank wrote a book, the major argument of which is the similarities between psychiatrists and shamans. And what he is saying is that those qualities that promote healing are identical, virtually identical when you look at what shamans or other traditional healers, and shaman is just a Siberian name for a traditional healer, what shamans and other traditional healers are doing, that if you look at it structurally and functionally, you'll see it looks very much like what psychiatrists do. So the book is really worth reading. It's a bit long, but it's well written. Jerry is unfortunately passed on from this world, but he was just such a genial spirit, and it's a really important book. And I think it came out in the maybe early 60s, but still very much worth reading. So everybody on this screen is in that role potentially. And we are the ones people coming to us as a last resort, right? When nothing else is working. It didn't work with the school counselor, the guidance counselor, the primary care doctor couldn't do it, the social worker they come to the psychiatrist. We are the court of last resort for people who have complex psychological issues. We're the shamans. So yes. So we need to understand that. And when William Osler was the great physician of the late 19th, early 20th century in the US, Canada, Great Britain. He once said, more people are cured by St. Johns Hopkins than by anything that happens in that institution. We call it placebo. Now, it's the belief in the power and authority of the institution, and as Jerry Frank pointed out, and others have as well, in us. And we need, one of the things that we don't do enough of, so I'm really glad for the question, is we don't make use of it. We don't make use of that authority that we have in a way, and we can not only make use of it, and I don't mean this to be authoritarian, but if people give us that authority, then we have the capacity to give it back to them. Do you understand what I'm saying? Everybody with me on this? If they look to me like I have the answers, I then say to them, yes. And my answer is that you have the answers.
One thing that are very specifically.
Somebody speaking, I couldn't hear what they were saying. Okay. So do you understand? So what I'm talking about is I welcome the authority that I have, and then I give it right back. That is the definition of charisma. It's not about me being a big shot or you being a big shot. It's about giving that power back to everyone. And we can do that. And that's a major role that I've played. And I want to emphasize this for all of you as you're working here in the middle of COVID-19, that as you understand your own understanding, because we do have all this education and all this experience, which gives us a certain understanding. And as you appreciate the power of self-care, you can give that back to all your patients, to everybody, and all the people with whom you're consulting. And it is
Dr. Gordon, can I make a comment?
Gift.
Can I interject for a minute?
Please.
Okay, so I'm listening to you, I'm finding it very interesting. And for whatever reason, your talk reminded me of a very old book that came out in England. The name of the book was Battle for the Mind. And it was written by William Sargent. And he did a lot of work in Africa. And what he found was that a lot of problems in terms of anxiety and interpersonal relationships is caused by inhibition. And I'm sure that since you are into the psychoanalysis, you read Freud's work like Inhibition, Anxiety, and Symptoms. So what they did was they would basically, in order to loosen themselves, they would drink, then they would dance in a circle till they got exhausted, then they would nearly collapse, and then once they came out of it, they would share the kind of things that they were ashamed of, that they never told anybody. And having done that, they found a tremendous amount of healing.
Mhm.
So I just wanted to just mention that to you, since I
Sure.
remember reading that book a long time ago.
Sure, thank you. No, I know Sargent's work, and I appreciate your mentioning him. Yeah, I mean, the other thing that this is what is new here is that we're democratizing. That I'm suggesting that we can play a role in enhancing our patients' not only their sort of sense of who they are, as well as their capacity for self-healing, that the model can shift. The model of psychiatry can move more into this area in which we're teaching more than we are treating. And that in the long run, that's going to be more important, and particularly in this kind of crisis situation, that with a small amount of teaching, of sharing what we're learning for ourselves and sharing it with others, we can make a major difference. And that we begin by conveying, sometimes through words, but much more importantly through our presence, what we have learned for ourselves. So what I'm going to do is I'm going to start now with, I'm going to teach you the soft belly breathing that Laura and Lois mentioned. And as I go through that, I'm going to teach you, or not teach you, because you know it all. I'm going to remind you of the physiology that we're working with when we bring ourselves into a state of greater calm. And this is when I'm working with people from the beginning. What I'm saying to them is kind of what I said to you, what I say in the first pages of the transformation. I say trauma comes to all of us sooner or later. It is not just something that happens in a war, not just something that happens to the people who've had the most abusive and cruel and neglectful childhoods, not just something that happens in COVID-19 during the pandemic. It is a part of life. And if it doesn't come to us early in life, it will surely come as we grow old and become more frail, lose people we love, and face our inevitable death. This is, again, this is not original. Every religious and spiritual tradition in the world understands this and often emphasizes it. So trauma comes to everyone, number one. Healing from trauma is possible. And what I do in the transformation is, in the beginning, I tell stories of people who were extremely traumatized and in the worst possible situations that I could imagine. A patient of mine who was a suicidal murderess, getting ready to poison her children, cutting herself, overdoses, multiple personality, many different diagnoses, who managed to come through it and come through on the other side. Another one, a friend of mine who became quadriplegic at age 21, 22, who's an extraordinary person. So I tell the stories to say it is possible. These people are, yes, they're exceptional, but they're also inspirational. So from the beginning, I say, and as I'm saying to you, it is possible to move through even the most terrible trauma. And I've been working with people who've been doing that for many, many years. So I'm saying that, and then I'm giving people an experience, and actually a succession of experiences that begin to give them the direct, to use the word again, the direct experience of being able to make a change in how they feel. And that's what I'm going to do with you. So I'm saying it's possible. I've seen it. There's research literature on it, which there is. Here are some examples. And now I'm going to give you an experience. And I'm giving you this experience because it's been valuable to me. One of the great crimes of current psychiatric training is that everyone in training is not in therapy. I don't know, in my day, sound like an old fart, but in my day, virtually everybody was in analysis in any kind of psychiatric residency, or at least in therapy. And how can you help other people understand themselves if you're not in the process of understanding yourself? How can you, regardless of what kind of psychiatry you're ultimately going to practice? And similarly, you can't help people take care of themselves unless you're engaged in that same process yourself. Because the authority comes not just from the science, although it's there, not just from the research, not just from hearsay or stories, but it also comes from our own experience. So what I'm going to do without any further ado is take about 10 minutes to teach you a basic meditative practice. And we'll send you the script for this. So you don't have to worry about taking notes. It's all the information is there in the transformation and all the scientific studies and stories. But even if you don't get that, we'll happy to send you the script so you can do this yourself. And you can look on our website, and I do a video of it as well. Okay, so this is going to take about 10 minutes. So make yourself comfortable however you're sitting. And allow your breathing to deepen. If you feel comfortable, let your eyes close. Closing our eyes eliminates a lot of external stimulation. And let your breathing deepen. And breathe in through your nose and out through your mouth. This is a very relaxing way to breathe. It may be unfamiliar to some of you, but you'll get the hang of it soon enough. What we're doing now is technically called a concentrative meditation, because we're focusing on the breath coming in through the nose and out through the mouth, and on the feeling of our bellies being soft and relaxed, and on the word soft as we breathe in, and belly as we breathe out. There are basically three kinds of meditation, three categories. There are thousands of different techniques. One is concentrative meditation, which we're doing, and please keep on doing this while I'm talking. And this is present in pretty much every spiritual and religious tradition in the world. First mention I've seen of it is in the Vedas, maybe 4,000 or 5,000 years old. Second kind is mindfulness or awareness meditation. The prototype is vipassana, Sanskrit word meaning awareness. As best we can tell, this dates to 2,500 years ago, to Siddhartha Gautama, the man we call the Buddha, the one who woke up. And it asks us to be aware of thoughts, feelings, and sensations as they arise. Third kind of meditation is the oldest on our planet, expressive meditations. Physical, fast, deep breathing, shouting, jumping up and down, shaking and dancing, whirling, chanting. All three kinds are enormously useful. We're beginning here with a concentrated meditation with soft belly breathing. Please focus on your breath coming in through your nose and going out through your mouth. On the word soft as you breathe in and belly as you breathe out. And on the feeling of our bellies being soft and relaxed. Breathing slowly and deeply like this with our bellies soft and relaxed, more air goes to the bottom of our lungs where there's greater oxygen exchange. So more oxygen enters the bloodstream. And as you know, oxygen feeds all the cells in our bodies. Breathing slowly and deeply like this, in through the nose and out through the mouth with the belly soft and relaxed, activates the vagus nerve, which, as you know, is the 10th cranial nerve. And vagus means wandering in Latin. And this big nerve wanders up from our belly through our chest, back to its central nervous system, to the brain. When it's activated by slow, deep, soft belly breathing, it slows heart rate, lowers blood pressure, helps the big muscles in our bodies to relax, and enhances our digestion. Breathing slowly and deeply like this, with the belly soft and relaxed, is the antidote to the fight or flight response. The vagus nerve, as you remember, is the parasympathetic nervous system. It's the antidote to the sympathetic nervous system's fight or flight response. It quiets activity in the amygdala, the portion of the emotional brain responsible for fear and anger. And breathing slowly and deeply like this enhances activity in areas of the frontal cortex responsible for thoughtful decision-making, self-awareness, and compassion. And one branch of the vagus nerve connects with other cranial nerves responsible for facial expression and speech. So when we breathe slowly and deeply like this, in through the nose and out through the mouth, we're quieting our body, calming the fear and anger in our minds, enhancing our capacity for thoughtful decision-making, making it easier to be self-aware and to feel compassion for ourselves as well as others. And we're also facilitating bonding as we're more able to read other people's facial expressions and tune into their speech. This is the antidote to fight or flight that's activated when we're under stress and we've been traumatized. Breathing slowly and deeply like this, in through the nose and out through the mouth with our belly soft and relaxed. All the muscles in our bodies begin to relax. And as you exhale, feel the relaxation in the muscles in your bodies, in your belly, and your pelvis and your buttocks. Feel them relax as you exhale. Feel the relaxation in your legs and feet with each exhalation. Feel the relaxation all up and down your back as you exhale. Feel your chest and shoulders relaxing. Feel the relaxation in your arms and hands as you exhale. Feel the relaxation now in the muscles of your neck and face and head as you exhale. Feel your whole body relax with each exhalation. To enhance this process, remember to focus on the breath coming in through your nose and out through your mouth, on the word soft as you breathe in, and belly as you breathe out, and on the feeling of relaxation in your belly. If thoughts come, let them come, notice them, let them go. Gently bring your mind back to soft belly. Okay, open your eyes, let your attention come back in the room and onto the screen. Okay, welcome back. I see a couple of empty screens, that's fine. Maybe people have fallen asleep. How many of you notice any difference from before we began 10, 12 minutes ago till now? Can you raise your hand? I want to see any difference at all. Okay, just about
Just one,
everybody.
just
Beautiful.
one sentence.
I'm sorry?
So, only one sentence, everything is right in the world. That's how I
Oh,
felt.
I'm going to ask you in a minute what difference you noticed. But the first point I want to make is that noticing a difference is crucially important. That what this 12 minutes, 10, 12 minutes, whatever it was, has shown you is that you can make a difference in how you feel. Just by breathing slowly and deeply with your eyes closed. This is vitally important. This tells not just a bunch of psychiatrists sitting around in the evening, but tells people who are going through very difficult times, even in the middle of a war, that they can make a difference. They may not make it, they can't stop the bombs from falling. They can't bring the war to an end. They may not even be able to change the amount of food they can put on the table, but they can change how they feel. This is a vitally important beginning, and as you're working with yourself and others during this time, when we are overwhelmed by forces we can't do much about, at least in immediate present, that we can make a difference in how we feel. What I have observed is that generally at least 80% of people are able to make a difference the first time they do this. I'm talking about people who've never even heard of the word meditation, never thought about, never gave a thought to it. They're able to make a difference, and that is crucially important because it means they're not helpless. We're not helpless, and we're not hopeless. And of course, you'll recognize those hallmarks of depression, helplessness and hopelessness. Simply doing soft belly breathing, and you can read the stories in the transformation. I've seen people who have learned this from me in a workshop no longer than this one, sometimes shorter, and they've done it and they've gone home and they've turned their lives around. Haven't talked with them again, and maybe a month later they get in touch with me and they tell me what happened, because they have the sense, I can make a difference. I'm not helpless, I'm not hopeless, because if I can make one change, the way our minds work by association, I can make other changes. Yes, I can calm my body, but maybe I can make other, we may not know that consciously, but our mind understands that. So what kind of changes did any of you notice? Anybody doing this?
I certainly
Lois?
felt more relaxed. Like just total, feeling of my whole body and mind being at ease, and
Okay.
it's self-soothing. It was,
Soothing.
yes.
Someone else text, rejuvenated, relaxed, what else? Say it or put it up in a text so we can all read it. Anyone else?
Peaceful.
Peaceful, beautiful, calmer. Anybody feel their shoulders a little more relaxed? I almost, well, many of us tend to carry our shoulders up around our ears, at least for part of the day. Yeah. Okay. This is beautiful. Anybody have trouble or difficulty? Difficulties are really important. We learn from our difficulties. Who had a difficulty? Anyone put it up on the screen or shout it out? Or mind wandering. Thank you, Elizabeth. Minds are going to wander. How many people had minds wandering?
Yeah.
My mind is all over the place. I had some wonderful ideas that I'm going to tell you about, Tati, as soon as we finish this. Ideas about things to do. And I had some others that were just kind of random thoughts that popped in. The idea of meditation is not to banish thought. The idea is to become more peaceful with thoughts and to have them be less overwhelming, less insistent. So just watching them and not being so caught up in them, not ruminating so much, not being obsessed with them, just relaxing with them. So pretty much everybody is going to have wandering minds. There may be moments when the mind is clear. Those are moments of grace. And as soon as we congratulate ourselves on them, we're back in our minds again, and our minds are filled up. Do you understand what I'm saying?
Mhm.
So this is about becoming more relaxed with our body and more relaxed with our thoughts. Now, there are some people who are so filled with agitation and so preoccupied with thoughts that this is very, very difficult for them. And that's a small percentage. Most people can do this for, 5-10 minutes without too much problem. But for those people who can't sit still, and I'm sure some of the people you work with, people who are really extremely anxious, extremely troubled, what I say to them is do something active first. We can talk more about expressive meditations, but even if you're not doing an expressive meditation like the shaking and dancing that Laura and Lois mentioned, have them go for a walk. Have them, stretch or do exercises or jump up and down or lift weights or do something or pound pillows to get it, and then encourage them to sit. It's fine. This is another point, not every technique works for everybody. Just as not every form of psychotherapy works for every patient. So part of what we're doing in this program of self-care is teaching a number of different techniques. In my book, I probably teach 20 or 25 different techniques. This one is fundamental because it brings us into physiological and psychological balance. It gives us a sense that we can do something to help ourselves. It gives us hope, and it gives us this foundation of biological and psychological balance, which makes everything else easier, whether it's the use of guided mental imagery or a psychotherapeutic interaction. Much easier if you're in that calm, balanced state, just because on physiological basis. Because the mind is more open. Imagination can work, intelligence can work. We're not stuck in our, in our reptilian or mammalian brain. We're not stuck in the brainstem or the emotional cortex where, we can make use of all parts of our brain. So let me stop and let's have some questions and issues that you have now. This is fundamental technique. I recommend that everybody learn it and use it. And if it's useful to you, start teaching it. This is the way to begin to work with people who are dealing with trauma, is to help them come back into balance. So questions from anyone? Yes, Laura, please.
A comment. I think this is actually quoting you, but the way I sell this to patients is that they can use it 3 times a day like a benzo, but it's not addictive, and it's just as relaxing and not right. So it's very, very effective. And if you sell it as a benzo, I think it boosts it a little bit.
Yeah, and the research is very, very good on the use, not just, this is a concentrative technique, the use on both concentrative and mindfulness techniques is extremely good in showing the incredibly powerful effects they have on neurotransmitters, on brain function, and also on brain structure. There's studies that are done, you can look them up, you can look at them in the transformation, that have shown that people who meditate for as little as 20 minutes a day can not only change the functioning of their brain, decreasing activity in the amygdala, for example, and enhancing activity in the frontal cortex and enhancing activity in the hippocampus, but also change the structure Sarah Lazar's work up at Harvard, starting almost 20 years ago, work that's done at University of California, San Francisco, repeatedly has shown increase in brain tissue in the frontal cortex in people who meditate. Britta Holzel's work as well, as little as 20 minutes a day. People just like us, Westerners. The original research on meditation was done on yogis who'd been practicing all their lives, and they could produce these incredible changes. Then the research was done on transcendental meditation practitioners by the TM people and Herb Benson and others up at Harvard. And these were people who'd been meditating for 15 or 20 years. But the more recent research and the more interesting research is ones that are done on naive meditators, people who take a course and then practice daily. And to follow up on what Laura said, is we don't, what I have observed over the last 30 years particularly, is that people who meditate as little as a few minutes, a few times a day, we haven't done the brain studies, but I can see profound differences in their levels of anxiety, in their mood, in the way they deal with stress and trauma. Simply doing soft belly breathing, morning, sometime during the day when they feel a little anxious, and doing it in the evening before sleep. So this is powerful, powerful medicine. And I haven't seen head-to-head comparisons with benzodiazepines, but I wouldn't be surprised if meditation did at least as well and with none of the downsides, only positive benefits.
Yeah.
Yes, Lois.
I actually
Dr.
felt
Gordon, is
like,
this different from?
Sorry, I couldn't hear you.
wait, I actually felt that when I was in a more relaxed state, I had some new insights, that like I had some thoughts that were, like worries that I just let go. But I also like when I'm more in a relaxed state, I had some new insights, and that was helpful. Like I realized suddenly my chair is really uncomfortable and just things that I had not necessarily thought of before, and because my mind's in a different place, and it helps. Yeah.
Great. Me too. One of the things I thought about, Tati, is we have our founding board of directors on the Center for Mind Body Medicine website. I want to put the founding advisory board, because Jerry Frank was on it, and I want to honor him. He's such a beautiful man. The other person, just to tell you briefly, another person who was on was Joel Elkes, who's the guy who really invented the phenothiazines. And in the latter years of his life, he shifted his whole interest to mind-body medicine, because what he saw was the power of the mind, particularly meditative approaches, that he could get similar benefits. He spent his whole life as one of the world's major psychopharm researchers. He became interested in the power of our minds to mobilize our internal pharmacopoeia to create the same and additional benefits. So yes, so you say Raghunath, is that how you say it?
Yes, you said it right, Dr. Gordon. You said it right. So I can talk a lot because I'm very familiar with Vedas and familiar with the Gautam Buddha and the Indian philosophy and TM, but I'll be very, very short. I feel that what we experience right now is a combination. Partly it's a combination of breathing and letting our mind go and letting our bodies go. And partly, I think, if you won't mind my telling you, partly it's your voice and you giving us the permission, in a sense, to forget our troubles for a little while, forget about worries for a little while, and devote some time to soothe ourselves. So I see that it's a combination. It's not only the meditation that we did, but also the permission that you gave, that we devote some time to ourselves and soothe ourselves. So I don't know what your...
Thank you. Thank you. And that's why we're still important as psychiatrists. That's why we have a role to play, because we're there. We can teach people, and our authority, our voice, our presence makes it so much easier for people. And then we can be there also to talk with them about what comes up in the meditations. Because if you start meditating and meditate regularly, I don't know if Laura and Lois, if you have been, everything will come up. All your anxieties, not just your creative thoughts, but all your anxieties, all your fears. And so it's beautiful to combine with doing any kind of psychotherapeutic work, because it enriches and deepens the experience enormously for people. And also, and what I tell people when I'm teaching them meditation is anything comes up, anything that's distressing and you want to be in touch with me anytime. Now, if they know they're going to see me in a week, almost nobody ever calls, but they need to know, it's important to know that I'm there. This is a process that does balance physiology, and as you do it, and particularly as you do it for more than a few minutes, all kinds of emotional issues may come up. And that's beautiful. And I say, that's fine. That's exactly what needs to happen. That's part of a natural healing process that's going on.
Is there a difference between the effect of
Deborah, you had your hand up, and then not. I'm using first names. Please call me again.
That's fine. Thanks. I've done this many times with patients. I work on an inpatient psych unit, so I'm very selective at this point with who I do it with.
I'm having trouble hearing you.
Oh, okay. Okay. Can you hear me now?
Yeah, that's much better.
Okay.
Thank you.
I said I work on an inpatient unit right now, so I'm very selective who I do this with anyhow. But you mentioned, we were talking about your voice. But one of the things I've noticed as I do it is that my voice gets very different when I do it with someone. My voice begins to drop down, go slower, go much more monotone and very soothing. I can put myself to sleep almost with my own voice. But it's something over the years that as I've done it off and on, I've noticed that so much about myself. And I had a patient just about a month ago. I think I discharged her 2 weeks ago. Very anxious. She spent a month with us, which was unheard of in a psych unit, but she did. Very, very traumatized from early on. But and I gave her meds too, but also I spent maybe about 10 minutes a day with her, with doing some relaxation, helping her learn how to do things and such. And she, and she commented on the fact, your voice is so different when you do this than when you're talking to me about anything else. And I said, yes, and you can do that too. So, but I think your voice is very important too. And I think our voice, it gives our voice as being, so it's, I always say that it's not, I'm not the authority and you're not the person without the authority. We're a team together and we work together and it's a partnership. And our voices are so important in that.
That's beautiful. A couple things that what you're saying brings up. You can give your patients a recording of you doing.
Yeah. Yeah.
And they really appreciate, because then you're with them.
Yes. Yes. Yes.
So that's number one. Number two, if you're working with people who are psychotic, diagnosed psychotic, or who tend to go off into some kind of other world, that's one of the reasons why I say you may want, if you feel comfortable, close your eyes.
Yes,
and the
exactly.
corollary is if you don't feel comfortable closing your eyes, leave them open.
Right.
And never force or push people to do this. If they feel uncomfortable, don't do it. This one's not for you. With psychotic people, I use more often, some of them are fine with this.
Yeah.
But I often start with the active meditations.
Yeah.
The expressive.
This woman was not psychotic. She was just depressed and such with all of it. But again, I understand exactly what you mean. It's also helpful to show things. I remember one time a person could not really get into any of the breathing and they happened to be lying on the bed in the room. And so I was sitting by them and I said, well, watch my hand. Breathe in and breathe out.
And, I want to move on to Nigel's question. Just want to say one other thing. You can do this. You can teach meditations for people who are on medications.
Oh, I know.
The only thing to be aware of is as they continue to meditate, they may need less
Less of it. Yeah.
because they're coming back into physiological and psychological balance, and a dose of medication. And the same is true not just of psychotropics, but also of medication for diabetes, hypertension, etc., that you need to titrate and you need to pay attention. Nigel, please.
Yes, it's a difference in the effect of the breathing technique from the progressive muscular relaxation, which was what I learned a long time ago and found very useful. But
Sure, that's a very useful, that's useful. This is somewhat different, but it's not, you know, the progressive muscular relaxation is kind of like the second half of what I did, becoming aware of the muscles and experiencing them.
yes, okay.
But that's also there are many, many useful techniques. And you have to, what I have done over the years is I've learned so many different techniques, and I stay with the ones that either I know have been very helpful to me. Pretty much everything I use has been helpful to me. But I don't use everything. So I like progressive relaxation, muscular relaxation too, but I kind of include a little bit of it in this one rather than do it by itself. Any other questions? Yes.
Thank you.
Hi, Dr. Gordon. So my name is Dina Abed. I'm a psychiatry resident here at Garnet Health. So I totally agree. I have personal experience with, I've been doing yoga even before medical school. And even I noticed how calmer it got me as compared when I was a teenager. Like even when I have these really extreme situations happen to me, people usually ask me, how are you calm? Like, why aren't you angry at this time? But the thing is, I've realized that patients who are really anxious, if they try to do the breathing techniques, it usually bothers them because they're thinking so much. And when they're in a quiet area, it makes them realize how much they're thinking so much. And that makes them more anxious. So what do you usually do with patients
Stand
like
up,
that?
Zainab. Stand up. Everybody stand up, and I'm going to show you something. Okay? Stand up, everyone. I'm going to back up a little. So, for people who are, thank you for asking the question. People who are anxious, we don't have time to do this whole piece. So I'm just going to show you I'm going to show you, demonstrate an expressive meditation. This is what I do when I'm really anxious. This is what I teach to people who are traumatized very quickly. And it's a 3-part expressive meditation. And again, we'll send you the script for this, and you can read more about it in the transformation, and you can watch a video on the Center for Mind Body Medicine website. The first part is shaking. So put your feet shoulder width, knees a little bent, and begin. That's it. Somebody's there loosening up the shoulders. That's good. And begin to shake from your feet. Shake your whole body from your feet up through your knees and hips up into your shoulders, and really shake. Knees bent, do it full tilt. Let the shoulders go and let your head go and let your jaw hang open. Just about everybody carries tension in their shoulders. Many, many of us carry tension in our jaws. So let the jaws hang open. And if sounds want to come out, let them come out. Go do it 100%. We're only going to do it for another minute or so. Just shake, really shake. Just let your shoulders go, let your head go, let your whole body go. Keep going. If you feel like slowing down, pick up the pace. Okay. So that's the first. Stay standing for a second. Just relax. The second phase is just relaxing, breathing deeply, being aware of your breath and your body. Just relaxing. And then the third phase is allowing your body to move to music. Come sit down again. You don't have any, well, move a little. Let your body, you want to move to the music that's in your mind for a minute or so. Just let it move. Whatever it is, it could be Verdi, it could be Bob Marley, whatever it is. Okay, come sit down. So, or what was that? How was that for you? Anybody? What, Zinab, how was that?
Yeah, it's really distracting from your mind. You focus more
Yes.
on your body. Yeah.
Yes, get out of your mind. Thoughts come, you go back to shaking.
Okay.
So read up on this. Do this one.
Okay.
Would I recommend anybody else? What was we don't have a lot of time, but I want to make anybody else want to share anything about this? Yes, Mohammed. No, you're muted. You have to unmute. You have to unmute. Ah, yes, there you go. How was it?
Well, it was great. You know, have you had any experience with, with the Sufism and
Yes.
how they do all of the rituals, meditation, and the movements and all that, and how does that help
Absolutely.
mind and body?
Sufis have been teachers for me.
Mhm.
So let me say a couple words, and then I want to circle back around.
Sure.
This is an expressive meditation, 5 or 6 minutes of shaking, couple minutes of standing. This is a way to begin. Couple minutes of standing and relaxing, and then have music on that inspires and energizes you. If there are 42 of us here, 42 different kinds of music probably we like. Who knows? I was listening to I Shot the Sheriff. Bob Marley was in my, whatever reason, that's in my mind right now. This is beautiful to do early in the morning. Great to do at the end of the workday. 5, 6 minutes. Again, Tati will send everybody the scripts. You can read all about it in the transformation. You can watch the videos of people doing it all over the world. And as Muhammad says, this is part of Sufism, these kinds of expressive meditations. Shaking, Kalahari Bushmen are famous for shaking. Tibetans shake. Going back to the Bon earlier, before Buddhism ever came to Tibet. They do Latahan in Indonesia. This is ancient stuff. Shaking is really, and animals, when they're in a confrontation with another animal, if you have dogs or cats or other animals, they get in a confrontation. Afterwards, what do? They shake. They get rid of that tension. They get rid of that fight or flight. Fight or flight is a major response to trauma, and stress that we have. The other major response is the freeze response, which is mediated by the oldest branch of the parasympathetic nervous system deep in the brainstem. And that shuts us down physically. We put out endorphins. We distance ourselves. Freeze response, fight or flight comes when there's a threat, emotional, physical, social. Freeze response comes when fight or flight can't do the job. So think about patients you've had who were abused as children, horribly abused. They couldn't, fight or flight couldn't do the job. They couldn't get out of there, and they couldn't fight because they're little ones. So they went into freeze response, and they're still carrying it around. Think about everybody you see, and maybe think about yourself as well, what we're carrying. Again, this is the deep insights of our profession. Now we know what the biology is. They're carrying around fight or flight and freeze. They're anxious, like Zena told us. They're anxious, they're agitated, or they're shut down emotionally. They can't get close to anyone. They don't want anyone to touch. They're scared. They're withdrawn. A patient of mine, she was in Chilean prison, 8 months, tortured every day, just about. Well, maybe not every other day for 8 months. The worst imaginable things that human beings can do to someone. Wouldn't let anyone come near her for years. Because, and that's not coming from a purely psychological thing. It's deep in the body. This withdrawal, you could see it in her body. You can still see traces of it all these years later, that shut down quality. So, soft belly breathing is the antidote to fight or flight. Shaking and dancing and the other expressive meditations, and there are many of them, is the antidote to the freeze response. I suggest you learn both for yourselves. Practice them, learn them, see what they're like, see the benefits, see the difficulties. Once you, if you do have a sense of their benefits for you, then begin to use them with patients. One of the reasons we're coming together now is because of the work that everyone is doing during COVID-19, and there's often not much time. If you can work with people with this approach, basically an educational approach, teaching, not just treating, but the emphasis is on teaching, and you can teach people to begin with soft belly breathing, and you can teach an expressive meditation, and you yourself can relax and be present with your patients, you're 90% of the way there. And all the other self-care techniques that I teach, all of the psychotherapies that you may do, they'll flower in this environment. Now, I want to say just a few words about what we're doing at the Center for Mind-Body Medicine, and you're welcome to follow up and be in touch. We've been doing this work for 30 years, for the last 20 some years, with whole populations traumatized by war, climate-related disaster, opioid epidemic, historical trauma, et cetera, et cetera. We're doing this now on a large scale during the pandemic. We brought all our work online. We're doing everything we used to do in person, we're doing it online. We have mind-body skills groups. You're welcome to join one of those groups. You're welcome to send patients to the groups. It's total sliding scale, down to $5 a group. 8 two-hour groups, teaching these techniques, experiencing the work, sharing your experience. This is the group coming together. We have 10 people in a group. We have all the webinars that you heard about that Laura and Lois mentioned at the beginning. Please look at them. They're all free. I'm doing one this Friday with 2 Black police officers who were part of our team. One is a retired NYPD lieutenant. The other is a captain in the Sheriff's Department in Broward County, Florida. And they're going to talk about what's going on in the departments and how they're using these techniques with other officers and in situations in their communities. We also have a training program. You're welcome to join our training program if it interests you. We have a full training program in mind-body medicine. We teach all these techniques. We teach the science. You learn how to use the techniques on yourself. You learn how to use them with other people and how to lead these mind-body skills groups. Take a look at the website. In the transformation, one chapter is about one of these groups. So read about it, see what it's like. The people who come through our training, including psychiatrists who come through our training, they love doing this work because it's not even so much work. You're taking care of yourself as you're leading a group. It's a relief from the burden. And in fact, let me just add that doing this work makes being a psychiatrist so much easier because I'm not taking I'm responsible, but I'm not taking burdens on for my patients. I'm teaching them. They're coming to me and I'm giving them tools and techniques for themselves, and I don't feel burdened at all. And when I lead a group, it's a joy because I'm also working on myself. When I lead a group, just the way I was doing shaking and dancing with you here, I do it with my group. Every technique I do, I share my experience with them. I'm the leader of the group. I make sure the group functions. I teach the techniques, but I'm also a participant. It's a different model than we learned in psychiatric residency and in medical school, but it's a model that is very enriching and enlivening. And it's a joy to do this work. So I want to leave you with that. I want to invite you to take a look at our website, to be in touch. We'll have your emails. You can get in touch with me. You can get in touch with the center. We have training programs that are online. We have one starting on September 30th. And the core group in that training, we're working with the whole city of Indianapolis. So we're going to have people, mental health professionals, first responders, educators, people who run the prison system, clergy. We train non-professionals as well as physicians and mental health professionals. And what we found is that if they're committed, they can do a really fantastic job, just as good a job at using this model. I'm not saying they can do everything we can do, but they can use this model, whether it's in a classroom or a small group or in work with individuals at a very high level. So let me stop because I know the time is up. I really, Laura, Lois, Liz, thank you so much for inviting me and for working with Tati to make this possible. So.
Well, thank you so much. We really enjoyed your presentation.
Real pleasure.
Well, yeah.
Thank you.
Great. Hope to see you all again sometime soon. Okay.
Yes.
Very
Thank you,
nice.
Dr.
Thank
Gordon.
you. Thank you so
Very
much.
nice, Dr. Gordon. Very
Okay.
nice.
You're very welcome.
Thank you.
And thank
Bye-bye.
everyone for attending tonight.
Yes.
Thank you, Liz. Thank you.
It was
Thank you,
great.
Liz, for organizing it. Thank you.
My pleasure.
Right,
Good
right.
night, everyone.
Bye-bye.
Everybody.
Good
Good
night.
night. Thank you.
And Tatiana, I'll be in touch with you tomorrow with the follow-up.
Sounds perfect. Thank you, Liz.
Okay, take care.
Thank
Bye.
you, Tatiana.
Bye-bye.
Bye-bye.
See you all.
Bye.
Yes, thank you. Bye-bye.
Bye-bye.